Hey guys,
Is your water here that you had earlier?
oh my gosh, that sounds terrible. I am out of my procedure. I just got 2 blood patches, one in my thoracic and one in my lumbar, and they've got the pain under control. It's not nearly as painful as the 60 milligram, which was really nice. But I'm going to be lying flat on my back for 2 hours, and then they're going to do an x-ray to make sure that my lungs are kosher, and then I'll be able to get out here and eat something.
Lots of updates. Where to begin? Look at all the pumpkin stove. Hi to the people. I made a video on my CT myelogram, but what I didn't show you was the aftermath. So the CT myelogram ended up being a lot more traumatic and a lot more painful than I thought it would be. And I think I've come to the conclusion that my body itself was just really angry with me, so everything was going to hurt. But we also think that maybe the doctor who was doing it was a little bit more gung-ho about it and didn't do things as gently as they could have. After my procedure, I was in a lot of pain. I had pain in my hips and in my lumbar and down my legs, which was worrying because in the summary that they give you, the information they give you before you do the procedure, it says that a possible side effect is to get what's called arachnoiditis. And the arachnoid mater is what it's called, is a layer of what's called the thecal sac. So it's the bag that holds your spine and your brain and separates it from everything else. Well, what can happen is that your body gets angry with the contrast and that layer becomes inflamed. If it doesn't get taken care of, it can cause eventual damage and scarring. So after 1 or 2 days of this pain, I noticed it wasn't getting any better, and I was starting to have like muscle cramping and charley horsing in my lower back and in my mid back, where the muscles would tighten and then they'd hold and hold and hold. So you just kind of had to ride out these muscle spasms.
Every time I try to stand up, the farther up I go, the more my shoulders tense.
Relax your arms, don't use any arm muscles.
Gosh, that was nice. That actually worked. Sweet. Oh.
He called and said, hey, she has these symptoms. What should we do? Is it arachnoiditis? Is this something where we go to the ER? And they said, let's be on the safe side. Let's go down to the ER and get you checked out. And the plan had been to drive down to Stanford. But for me, that's 4.5, 5-hour drive. So we got in the car completely committed to going to Stanford, but at the point that I had managed to get in the car and was driving down, I was in enough pain where realistically I was not going to make it to Stanford. So what we decided to do was take a detour and go to my local hospital ER and explain to them, hey, we have been going to Stanford for a possible CSF leak, and we did a CT myelogram and these are the symptoms she's been having. Something that we did that was really important was that we gave them the phone number of my doctor at Stanford so that they could talk to him and talk over my symptoms and come up with a treatment game plan. So after talking with my Stanford doctor, my ER doctor decided to treat me for the arachnoiditis, so they gave me pain meds as well as IV fluids because my pain level was high enough. I was starting to get pretty syncopal, very close to passing out, which would have been no good. They also kept me overnight for observation because they gave me a steroid burst. So they basically just pump you up full of steroids in order to get the inflammation down and to resolve the arachnoiditis. So my experience with the ER was really good. Everyone was listening. Everyone was taking me seriously. they sent me down for a MRI with contrast, which was different from the CT with contrast, because the MRI with contrast, they put the contrast into my IV versus doing a spinal tap with the contrast, which revealed that I had CSF leakage pretty much from my sternum down to my tailbone almost. So I was truly leaking. We stayed overnight, and then the next morning is kind of where it got funky, because I was handed over to the day shift team, and they had a day shift hospitalist, and the hospitalist decided he was going to be curious and send me down for a tilt table for another reason than he was curious. My frustration lied in the fact that I was told that he was testing me with the tilt table due to something they saw on the MRI. So they were very misleading about it, and at the point that we confronted him about it, he was shying away from the questions, and it was very clear that he had not respected my rights as a patient. I called my Stanford doctor, and he said, yeah, doing the tilt table was bad timing, but it didn't increase the leak or make the leak worse, which was really good because I was worried about that. I actually ended up not passing out on this tilt table. My first one, I passed out in almost 8 minutes flat, and my heart rate got down to 36, and they had to do a sternal rub. This time around, because I was on steroids, that increases your heart rate, increases your blood pressure. I'd been on IV fluids for over 24 hours, so it was very unlikely that I was going to manage to pass out. So I felt terrible, but it didn't do any permanent damage, so that was good. So I went home, and I was on steroids, I was on pain meds and muscle relaxers and the whole deal. But when Monday rolled around, I still wasn't feeling too hot. And my doctor called me to do a follow-up to see how my ER trip had gone. And we went over what had been done, the tests that had been done, and the symptoms I was having. Because at the point that I come home, I was starting to have tinnitus in my ears, so I had ringing in my ears. And I couldn't hear as well out of my ears. And then I was also starting to have trouble with bladder control, where I was actually peeing myself. Good for me. But at that point, he decided, you know, it's been a week. If you were going to stop leaking, you would have done it by now. So he decided that I should come down pretty much as soon as possible to get a blood patch. And a blood patch is where they take your own blood and insert it where the leak is. And the kind of congealing, healing properties of your blood works as a Band-Aid to kind of seal it up until it heals. He said, let's get it done sooner rather than later so you can attempt to enjoy your Thanksgiving, which I'm very happy about. So we went and got a CD of my MRI to give to my doctor, and then we jumped in the car and drove our way down and got a hotel. And the original plan was that we were going to go to the ER and get what's called a blind blood patch, where they don't use any kind of imaging, they just kind of stick it in the general area. But he decided that since I did have other problems besides the CT myelogram leak, that he would get a lot more bang for our buck if we decided to go to the ambulatory surgery center. And so they checked me in, and we went over our CT, and he basically said, so, yeah, you are leaking here for sure from the CT myelogram. And then there's several other spots on your myelogram that indicates that you may have other leaks present. So the plan for today is that we're going to go in and seal the leak from the myelogram, and then we're going to attack the one in your thoracic cavity to see if we can help with the chronic leak. And he explained all of kind of the downsides and the possible worries that we had, because the thoracic leak, they were going to have to attack it from the front of the spine versus the back, so they were going to have to go at an angle. And he said, we're going to get within a millimeter of your lung. So if you start to feel like you can't breathe, that's something we need to know about. And everything ended up being fine, and so I didn't have any issues as far as that went, but it was definitely a little startling. But the way they set it up is that you have one IV to do all the meds, and then they actually do one where they have what's called a IJ tube, or an IJ line. So it's a intrajugular? Intrajugular. And so that's where they get the blood for the blood patch, because it's big enough and it has enough blood to where they can get it in, and, or take it out and put it back in before it starts to clog and get congealed and gross. So they took me back into the OR room and they did sterile procedure. They stuck the needle in and then had me lie down similar to the CT myelogram where I was Superman, and then pumped me up full of, they gave me anti-anxiety, they gave me anti-nausea, they gave me pain meds, they gave me antibiotics just in case, because they are entering a sterile portion of your body, so they don't want to introduce infection. I mentioned that they gave me Benadryl as one of the drugs that they gave me before we started, and it ended up being a good thing because I did not have an allergic reaction, but I had what's called a histamine reaction, or a mast cell reaction. So I ended up getting what looked like a rash, a dark red rash, and it went away in a couple minutes, but it's basically your body's way of going, what the heck just happened to me? And then from there they did the lumbar, and then they did the thoracic, and it was uncomfortable, but he was explaining the procedure the whole time. He told me what he was going to do before he did it. It was very concise, very clear. There was no surprises on my end, so I knew exactly what I was expecting. And so the anxiety level was a lot lower this time around, and the pain level itself was a lot lower as well. I think that they are a lot more delicate in their precision of the procedure itself, so it wasn't nearly as painful or traumatic, and I felt much, much better after the procedure than when I did the CT myelogram. Tips and tricks for medical procedures of any kind. As far as my shady hospitalist who did a test that shouldn't have been a test, make sure that you ask what it is that they're doing and why they're doing it, and if you think that their reasoning isn't sound or you're not comfortable with it, it is completely within your rights to say no. If it gives you hinky feelings, follow your gut. And as far as procedures in general, my doctor was very good about making sure I was informed of all of the risks as well as benefits, and took the time to answer all of my questions before he did anything. So something to make sure of is to make sure that the communication between you and your healthcare providers is very strong, and that there is no question in your mind as to what's going to go on, how it's going to go, and how you're supposed to feel afterwards. So keeping that line of communication open is key.
Oh boy, I should have shaved my face before doing this.
Oh, we didn't know that you were going to do this today.
Tape is by far, oops, I'm sorry. It's the worst.
Oh, this is too terrible.
Okay, here we go for some more terrible parts. All right.
He's taking the tegaderm off.
I'm taking the tape off now. I sure did leave a long enough hose there. Didn't
I know. I have a leash.
I actually think that the tape is usually worse than the IVs
Oh, it's
themselves.
way worse. Now, we'll grab a hand of that while I rip it. We're going to rip now. Yeah, exactly. Thank you so much for
You're
assisting.
welcome.
Ready? We're going to just slide it right out.
Ta-da! That
is a lot.
But I'm going to hold on to this for just. I'm not hurting you, am I?
No.
Okay.
He's got to keep pressure on it for probably 5 minutes.
Yeah. Although this is just in a vein,
Mm-hmm.
so it's not like removing something out of an
Artery,
artery.
yeah.
Yeah.